If you are a parent and you're looking for a healthcare provider for your child, but you wish you had someone more natural to take your kids to, someone who would talk to you more about nutrition, supplements, maybe even alternatives to medication, I bet you've probably not had an easy time in your search. So I've decided to invite one of our community partners to join us today to talk about how she provides natural healthcare services for children. Hey guys, I'm Dr. Emil Tompkins, and wasn't expecting that extra sound. And over the last 16 years, we have been serving families in southern Arizona. And our mission has always been to help families grow healthier every day by removing the physical, chemical, and emotional barriers to good health. And we certainly cannot accomplish that on our own. We partner with local experts who can provide the best care and resources for our patients and the community. So, today we have Dr. Kate Sage. She's going to talk with us about how to help your family live a healthier life naturally. Dr. Kate is from the North Woods of Wisconsin, but she did her undergraduate work, medical school, and naturopathic training in the Pacific Northwest. Before moving to Tucson almost 3 years ago, she had a private family practice in Prescott, Arizona. Dr. Kate has been practicing medicine for 12 years, and in that time, she's realized that pediatrics is what brings her the most joy. She sees newborns, children, teens, and their families for well checks, as well as most acute and chronic issues at Intuition Wellness Center. So, Kate, Dr. Kate, welcome. Thank you so much for joining us today.
Thanks so much for having me. It's a pleasure.
Well, we really appreciate you being here. Can you tell us a little bit more about you and your practice?
Yeah, so I'm a naturopathic doctor, which means that I really focus on using natural remedies as much as I possibly can. Although at the same time, I was trained to use pharmaceuticals if I need to. So if I do have a child with bad strep throat, we're going to talk about antibiotics. So it's nice to have all of those tools in my tool belt. And I was also trained to do newborn checks and well child checks and all of those things that are, the happier side of medicine. And so a lot of times my job is playing with kids while I check them out. So I really love my job. I'm a pretty lucky person.
That really is special, so you get to combine both aspects of medical care, the natural aspect, and then actual medicine. You put both of those together when you need to.
Yeah, exactly.
That's really cool. So, what are some of the most common things that you see in your practice?
Well, before COVID, I did see a lot of ear infections and strep throat and that sort of thing. Lately I've been doing more telemedicine to actually help people through this tough time. So, that's kind of the acute part of it. I have been limiting well child checks to the younger children, especially babies. So, to be honest with you, I've been seeing a lot of babies lately, and which isn't so bad. It's kind of sweet to have my caseload filled up with babies. As we're trying to push off the well childs just a little bit, to keep everyone safe at home. And what else have I been seeing? Lately, I've been doing some extra work, kind of digging deep into EDS, which is Ehlers-Danlos syndrome. And so that's
Oh,
another thing that's been popping up a lot on my calendar because there aren't a lot of people in Tucson who, feel confident and know a lot of aspects of that. So that's another place where I've kind of been, expanding my practice. And then finally, one of the things that I've been seeing a lot is vaccine consultations because I think people are starting to understand that maybe the choices they made at the beginning aren't the choices that they want to make now around vaccines, and maybe they want to do catch-up schedules or they're just having second guesses about vaccines. And I try to make a safe space to have that conversation. So
that's
yeah,
really fantastic because I think a lot of times, and boy, you gave me a lot to talk about here.
yeah. I
A
just
lot
realized
of
I tossed
a
a
lot of
yeah.
times, no, that's fantastic. So many times, I think when parents have questions regarding vaccines, that conversation that conversation doesn't seem like a very safe conversation. That any questions or worries or concerns are met with are met with a lot of resistance instead of the opportunity to really work through some of that. So that's pretty fantastic what you do, especially right now. I'm sure that conversation is happening a lot. So it's good to know that you're there to have that conversation with families that maybe have questions or thoughts or concerns, or and just to be able to have you as a resource really is fantastic. So I
Sure.
feel like we need to maybe dig into EDS a little bit, only because, and I'm so glad you had mentioned that. That is an issue where people really are searching for answers, and and struggle a lot. We'll see it in our office where people are dealing with a lot of pain because of that hypermobility that comes with the EDS. So if someone is coming to you with Ehlers-Danlos syndrome, what are the how do you go about caring for them, or what is a plan of action?
Yeah, so I have done some pretty significant training around this condition, and what I've learned is that it is so big. There's so many different pieces to this that I don't think anyone should ever call themselves an expert to this condition, honestly. Um, One of my bigger thoughts around it is just to help people put all the pieces together and hold those pieces really so that they can see the recommended specialists that are going to help them best. And so you might need a rheumatologist, and they might need a cardiologist and a gastroenterologist and blah 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 blah. And so helping them get to those people who are going to understand their condition and how that is related to their EDS is one of my big pieces, I guess, as a primary care doctor, helping them find those resources. And also, as the primary care doctor, I need to understand that not everything they show up with in my office is going to be their EDS too. So, um, understanding that what they call it diagnostic overshadowing, like you can't just say, oh, that's your EDS. You have to say, well, maybe that headache is really just because you're really stressed out, instead of it being because of your EDS, if that makes sense. And so
Yeah,
I have to kind of look at them as a whole person and not just as a condition.
yeah.
So, but I am always on the lookout for different aspects of that condition, like POTS, which is the postural orthostatic tachycardia, which can show up commonly, or also mast cell activation syndrome is another one that shows up with it. So just keeping my eyeballs out for these like downriver conditions that also are associated with EDS. So
Wow. It's so much more than maybe initially what we think we're dealing
oh,
with.
for
There's so
sure,
many
yeah, it's
things
huge.
that are involved. Wow.
And not to scare people about,
Yeah.
if you get the condition, sometimes people are just hypermobile and have joint pain, and that's okay. But then it also can look a lot more complicated. So
Yeah. Well, it's good that people have someone like you to be able to lead and guide them um, through this process. So that's really fantastic. So give me an idea, Dr. Kate. What are your overall just do you, your overall philosophy on health and what you do to help your pediatric patients be really healthy?
sure. Um, I think one of the things that I do that's different is I treat every single patient and every single family as an individual. So there's no protocol, if you will. So, as a mom comes in and she's having, problems with their baby with reflux or something, I'm going to look at all aspect of her, what's happening with her and her family and their pets and whatever, everything's involved. And so to actually make a treatment plan that's going to be best for them. So I think that that's where the art of medicine really comes in. And what I appreciate is that, if I have 10 babies with reflux, I might have 10 different, approaches for each and every single one of them. So I think that's the big thing for me.
That's fantastic. So very
Yeah.
individualized care that they're getting. All right. Well, I really, really appreciate this. You have given us some great information. And my hope is that families, as you're watching this video, as you're getting the information from Dr. Kate, let's not just take this information and go home and not do anything with it, or walk away and think, oh, that's so great, I learned something new about EDS or how a naturopathic doctor takes care of kids. I mean, that is all really great, but what are we going to do with that information to really make a difference in you, in your family, and in the health of your family? I challenge you today to take the time to take that next step to experience Dr. Kate and Intuition Wellness and the care that they provide. Dr. Kate, is there a way? What's the best way for people to contact you if they need to experience your services?
I would say the best way would be to go to our website, which is intuitionwellness.com. And you can find all of our contact information there. And then we also have a form that you can fill out, and it will have either, the admin staff or myself call you back so that, we can figure out whether or not you're a good fit, or, if I can help you, or, et cetera, et cetera. So I would send you to our website, intuitionwellness.com.
That's awesome. And I'll make sure that in the comments, if you're watching the replay, in the comments, I'll make sure that I have links to the Intuition Wellness website so that you can check that out. And yeah, that's really, really tremendous. Dr. Kate, thank you so much. I'm thankful for you getting on here today to talk to us about what you're doing. It's so important at a time like this that for our community, that you're seeking out providers that are leading the charge towards health at this time, those who are taking a stand for patients and families, and can provide calm and assurance and leadership during this time of uncertainty and volatility and just all the craziness that's involved in what's going on with COVID. As things change, as things normalize, the people who are leading you in that process are always going to be here for you. So, Dr. Kate, I thank you for being here for our community. I thank you for reaching out and giving your expertise and information to my patients and the community that we're here involved with. And so I thank you so much for today. This was incredibly helpful.
Oh, thanks so much for having me.
All right. Well, guys, thanks for joining us. We're all set for today. I'm Dr. Emil Tompkins. We have Dr. Kate Sage from Intuition Wellness. Thank you for being here. Have a fantastic day, and we'll see you soon.